Hello, and you're watching TV9 News, and I'm your host Deepak. Now, COVID-19 doesn't spare anybody in its way. Now, why I'm saying this is because earlier there were reports that claim that children are less susceptible to COVID-19 compared to the adults, but that was because the kids basically were confined to their homes during the lockdown, and even after that, online classes spared them from going out and getting infected. So soon after the schools reopened, and then it all started tumbling. As many as 472 children below the age of 10 have been reported positive for COVID-19 since the beginning of the month of March. So of the infected children, 244 boys and 228 girls have been infected between March 1st and March 26th. So the daily COVID-19 cases among children were limited to 8 or 9 during the early days of March, but it has already steadily risen to 46 on March 26th. Now let's speak to Dr. Sutesh Roy, an immunologist, and get more insights about these findings. Doctor, firstly, there is a rapid surge in cases among kids who are under the age of 10. Is reopening of schools the only reason, or are there any more reasons that you would like to list out?
So Deepak, definitely there is an increase in children getting infected with COVID-19 lately, and this is a trend that was seen in the UK, also seen in Israel, and also seen in Italy during the second wave of their COVID-19 infections. And this has, yes, partly been connected with the reopening of schools. Especially in UK, there was a study in the British Medical Journal, a newsletter, which clearly stated that when reviewed, children who were back in school had a higher risk of transmitting infections even to the adults in the house. It is also known that the UK variant, the B117, which is also present in India, and there is another variant in India called E484K, which behaves just like the UK variant, is highly transmissible and seems to be affecting children more than adults. Clearly, behavioral reasons as well as mutations in the virus both are causing this increase in children having more COVID-19 infections lately.
Also, doctor, previously there were reports that kids are less susceptible to COVID-19. Are they really less susceptible, or is it the other way around because kids have no vaccines for them?
Yes, Deepak, children are less susceptible to SARS-CoV-2 for two reasons. One, the ACE2 receptor through which the SARS-CoV-2 virus enters human cells are less in number in children's airways than they are in adults. The second reason is that children's innate immune system and lymphocyte counts tend to be higher, both of which are very beneficial in fighting the virus, and hence even now the risk of severe infections or hospitalizations in children remains very low, and they mostly get asymptomatic or mild infections. When we look at the susceptibility of children, it is more related to behavior and exposure, and in that whole process it becomes very important to recognize the changes in the virus that are occurring. Children not receiving vaccination could not have been an issue. Even in the first wave, they didn't have any vaccine, but they were indoors and in their homes much more often. Now they have been traveling with their parents. They've also been coming out to play more, and they've been going to school in certain parts of the country. And all of that is really the reason why we are seeing a rise in infections.
Now, last question is, doctor, what can the parents do to ensure that their kids are safe in schools, and what can the school management do on its part to keep their students safe?
So Deepak, parents should realize that if their child has the slightest cold, cough, fever or any viral symptoms, that child should not be going to school at all till they are completely evaluated and better. Also, getting them tested if any of these problems are there can help in preventing the spread both within the family and to other children at school. Besides this, parents have to again emphasize and train the children about wearing their mask at all times, making sure that in the schools there's enough physical distancing when the kids are sitting, for example, for lunch breaks or other areas. Making sure that the gathering in places is reduced as much as possible, If there are air-conditioned classrooms, increasing the ventilation in the rooms by probably keeping the windows open. Little measures like that combined with awareness amongst the children to wear their face mask, hand wash, maintain physical distancing, take care even during public transportation and travel through school buses, because these can be areas where the virus can truly spread. And if the cases significantly increase in a certain part of the country, then closing down schools, colleges, because it's not just the kids below 10 but also the teenagers and young adults who are showing an increase in COVID-19 infections in the country and around the world. So with all these precautions, I think we can again prevent and hold the spread down.
Well, the old and vulnerable still have hope as they can get their vaccine shots. But as far as kids are concerned, there is no vaccine whatsoever. Earlier, kids used to be protected, but since they are exposed to several events, the risk has also gone up considerably. A message for all parents and staff members: please make sure kids at home and schools are following all the safety protocols and educate them about the importance of these norms, because this is the only way forward. So spread the word and save lives. And as far as the Karnataka government is concerned, it is yet to take a call on whether or not to close down schools and pass the kids to the next grade. Health Minister Dr. K. Sudhakar hinted that the government will impose lockdown-like restrictions in the nearest future. So it all depends on whether the cases come down or not. And for the cases to come down, you must follow all the safety protocols. Leave your opinions in the comment section below on what you think the Karnataka government must do. Also, like, share and subscribe to TV9 News. Thank you for watching, and a very happy and a safe Holi to all of our viewers. Cheers.